So this is the new material for the final for our parasitology. I am having really bad seasonal allergies right now, so I'm so sorry that I probably sound terrible. But the first thing that's on our new material is going to be ruminant abortions. So the three main parasitic causes of ruminant abortions are Neospora caninum, Toxoplasma gondii, and Trichomonas fetus. All of these we've seen before because they used to come from, well, come from dogs. That's from cats, and there's Toby. So the first one is Neospora caninum. And so a dog would be nearby, and the dog is what laid the oocyst. So the cattle will ingest the oocyst. It goes into the intestines and becomes a tachyzoite. Once it does this, it can then go transplacental and affect the baby. So there's different ways that it can affect based off of which stage of gestation that we're in. Early gestation, you'll have early embryonic death. So basically, just really quickly, may not even know that the cow was pregnant. Mid-gestation, abortion or the birth of a weak or abnormal calf. Late gestation, the calf will survive, but it'll either be neurologic or weak, or it could be normal and just have antibodies developed against it. So how can you diagnose it? Before death, you can technically do serology on like mom. After death, you would do histopathology on the brain and heart from the fetus and run PCR from it. Clinical signs would be an abortion storm, low steady abortion loss. That's going to be the theme between all of the ruminant abortions. Risk factors is if you have farm dogs around, so don't let them eat the aborted fetuses and try to keep their poop away from water, which is easier said than done. Sadly, there's no treatment. Good thing is it's not zoonotic. To control, you test and you cull the ones that are positive. And if you have a cow that shows that it's seropositive or has had abnormal offspring, you don't rebreed her. The next one is Toxoplasma gondii. I messed up. So it's only in small ruminants, not in our cattle, So sheep and goats, they ingest an oocyst. The tachyzoites will destroy. Bradyzoites are what rest. This is the same exact way in our cats and in the humans. So just now in a sheep or goat. Then it can transfer via the placenta, via the fetus, or the milk. Once they're infected, the doe sheds for the rest of their life. So that milk, they will be shedding constantly. And so we can actually get it through their milk. So that's why pregnant women shouldn't drink like goat milk. Clinical signs, again, abortion storm. Lambs are born with neuro issues. Stillborn, pancreatitis, so the placenta is infected. And the mom may have some neuro issues because the tachyzoites are affecting them if they're stressed or immunocompromised. Again, that's the same as humans. Same diagnosis is the IgM versus IgG serology. If you don't remember how that works, IgM is usually like the first antibody that responds in the body. So you'll only find IgM if there is an active infection. So that shows that mom currently has tachyzoites floating around the body and it can hurt the baby. IgG, I say G for gone. That means that it's already gone through its process in the body and now it's resting as a bradyzoite. So it is not as likely to affect the baby. No treatments. Prevention, keep the cats out. Dispose aborted remains. You can do ionophores in late gestation to prevent transmission across the placenta. The last one for ruminant abortions is, sorry, you can see the next page, is Trichomonas fetus. So it actually transmits venereally. Most of your trichomonases do. So if it's in a male, it'll be found in their preputial and penile mucosa. Females in their urogenital tract. That's little trophozoite. It looks the same as all other kind of trichomonases that we've seen. There's really only the trophozoite stage. Pathogenesis, if it's a female, you'll see symptoms. If it's a male, they usually don't have symptoms. You might see that they have irregular estrous cycles or short-term fertility, endometriosis, pyometra, mildly inflamed. The baby will be born early and will be dead. The fetus might be macerated already in the uterus. Diagnosis is an in pouch, and there's different places that you collect based off of sex. Female, you would go to the cervix or the vagina. And you can also just collect from uterine discharge that comes from pyometra. Male, smegma, or you can just do a preputial washing. Fetus, you go to the abomasum or placental fluids. So because of how dangerous this is, all bulls that entering this state, so we learned Alabama because we're here, if they are above 18 months, they have to be tested and be negative. You do it via PCR. You can do it up to 60 days before entering the state, but if they mate with a female within that 60 days, they have to get retested again. The test has to be done by the vet. If it is positive, you have to report it to the state vet. It is technically worldwide, more common in our beef than our dairy. There is no treatment. Main treatment is you kill the positive bulls, and absolutely no metronidazole. It is illegal to give metronidazole in food animals. Prevention, keep a closed herd. Again, cull all the infected bulls. If a cow has early abortion and cycles again, you cull them as well. Test all the bulls before use, and you can do artificial insemination to just ensure that nothing from their little male parts, there we go, preputial and penile mucosa doesn't come in contact with the cow. Okay, now the bugs. This will first start with ticks. So most of these ticks we've seen before. Ixodes, they're in the northeast and midwest. Three-host tick again. Nymphs are in the warmer months, adults in the cooler months. I like to think of it as like, your teenagers like to go and have all their crazy parties in the summer and everything, and adults like to go and like sit by the fire and have it really chill and cool in the winter. They like the woodlands. They vector Lyme disease, mainly Borrelia burgdorferi, and then anaplasma. The next one is Amblyomma americanum. That's our lone star tick. It vectors heart water, which is with our horses. Both of the amblyomas actually vector heart water. So amblyomma is for heart water. So amblyomma is actually opposite of Ixodes. So I remember the way of like the teenagers liking the summer for Ixodes, and then just remember that this is opposite. Again, three-host tick likes the woodlands. Amblyomma maculatum is the Gulf Coast tick. Again, vectors heart water, or Ehrlichia ruminatium. The biggest thing with these in our cattle is they like to attach to the ears and they cause gotch ear. It's an immune response to the tick saliva, and it'll cause the ear to thicken and bend, and it will be permanently deformed. A newer tick that we didn't have with our small animals is Amblyomma cajunense. It is the cayenne tick. It is in the U.S., but it is confined to the South. But in other countries like Central and South, or the countries in Central and South America, it is found year-round. It is a three-host tick, and it vectors Theileria equi, which is equine pyroplasmosis, which is a foreign animal disease. Dermacentor variabilis, we've done this one again. It is the American dog tick. It is found here in the eastern U.S. Again, it's opposite of Ixodes. They're adults in warm months, three-host tick in grassy meadows. It vectors Anaplasma marginale. Dermacentor nitens is your tropical horse tick. It is found in Texas, Florida, and the tropics because it also vectors equine pyroplasmosis, which again is a foreign animal disease, so they try to keep it confined to these areas. It is a one-host tick, likes the shrubs and brush, and likes to infect ears. Dermacentor albicatus is the winter/moose tick. It is found across the U.S. and in Alaska, which I think is funny because Alaska is the U.S., but whatever. One-host tick has both an ornate and an inornate form, which is interesting. It vectors Anaplasma marginale, just like this Dermacentor variabilis. So variabilis and albicatus vector the same thing. These will actively quest because they are obligate parasites. Obligate means that they are required to live on a host to survive. They can cause severe anemia and alopecia. We have done Haemophilus longicornis. This is the Asian longhorn tick. They are invasive and they vector this foreign animal disease, Theileria orientalis, which is the Ikeda strain. I'll talk about it later. They are parthenogenic. so they don't really need males to reproduce, and they can cause cattle death. We've done Otobius I'm so sorry, I just can't talk. Otobius magnani, which is the spinose ear tick. It doesn't vector anything, which is good, but they are really irritating. It is zoonotic. They are found in most animals in the external ear canal. And the adults are not parasitic, but the larvae and nymphs are. Ornithodorus coriaceus is the pajuelo tick. It is causes a painful bite. It's found in the west coast U.S., so thankfully not here. And they only feed for a very short amount of time, so it's hard to actually ID the tick on the animal. They will vector, I looked up how to say it and I just can't remember, Pajaroelobacter abortivobovis, which is foothill abortion, or also known as epizootic bovine abortion. So just remember foothill abortion. So this is just general tick things right here. To control them, you can reduce the rodent host, because most of these actually require a rodent. Eliminate the shrubs in the woods. You can do pasture burning. There aren't really any things that you can spray in the environment to kill them, but you can treat your cattle with permethrin and coumaphos like sprays across their body, which is what they use to control a lot of the foreign animal diseases when cattle have to enter the country. So then we go into our mites. The three genera that are sarcoptiform are our Sauroptes, Sarcoptes, and Chorioptes. The ones that are not are Saurogates and Demodex. So all of these have the same PTES ending. So just remember PTES ending will make it sarcoptiform. It doesn't matter which kind you find, you report all of them. But the ones that are most important are going to be your Sauroptes, the ones that infect our cattle and the ones that infect our sheep. These are just some random ones that I don't talk about as much. So Sauroptes communis capre is with goats, capre for goat. Sauroptes ovis is horse. It's not here in the U.S. It's only in England. And then P. ovis can also infect our rabbit, and it'll cause ear canker. Hold on. I have lost my next page. Where did it go? Okay, sorry. So these are the ones that I was talking about that are important. Our Sauroptes communis bovis is with cattle, common cattle scab. Sauroptes communis ovis is the common sheep scab, and it is eradicated in the U.S. Sauroptes spreads by contact and termites. They are non-burrowing. They have elongated mouth parts, long jointed pedicles, oval body. The signs that you see, it is just your normal signs of scabies. Papules, moist surfaces, hyperkeratosis, alopecia, and lesions. Same kind of diagnosis, clinical signs, skin scrape. Sarcoptes in your large animals are rare in the U.S. That's why you report them. They look like Sauroptes, but they're not as severe. And I mean, it just looks the exact same as it did in dogs. So then this is our third form of the sarcoptiform mites, the Chorioptes. And thankfully, all of them kind of just go with the name that they have. So Chorioptes bovis is with the cattle. Chorioptes equi is with your horses. It's leg mange. Chorioptes ovis causes foot mange with our sheep. Chorioptes capre, which is our goats, usually infect like the head, the neck, and the hind limbs. Signs, small wounds, skin swollen and inflamed. You'll have thickened, wrinkled skin. Treatment, you can inject isoxazolines, state report, and then the dips. So then these are our lice. Hematopinus uristernus is the short-nosed cattle louse. It is a sucking louse. And then Linonathus vitili. Nathus, usually think of mouth. So long-nosed cattle louse. It's seen more on calves. That's also a blood-sucking louse. And then Damalina is the chewing louse. Horses only have two. They again have Damalina, the chewing louse, and then Hematopinus as well. So Damalina is chewing, Hematopinus is sucking. Okay, so then we get into foreign animal diseases. So ways that we get clued in to foreign animal diseases is if you have a random increase of dead animals, random abortion storms, severe breathing issues, just unusual skin lesions, nervous system problems, unexplained illness. Basically, you don't know what's going on. Trying to find an answer. First one we talk about is bovine babesiosis. It's also called bovine pyroplasmosis or Texas cattle fever. This is the one that we watched the video on the tick cowboys where they go and like monitor the cattle that crosses the border to make sure that they don't have rhinocephalus, annulatus, or microplus, because bovine babesiosis is vectored by rhizocephalus, annulatus, and microplus. It can transfer through the ticks transstadial and transovarial, which is no good. Life cycle, the tick will bite, they release sporozoites in their saliva, goes to the red blood cells and forms trophozoites, will develop into merozoites, rupture out, and just continue the cycle over and over. Pathology, they'll have fever, intravascular hemolysis, hemoglobinemia, hemoglobinuria, and then neurosigns if these like trophozoites and merozoites, they've swollen the red blood cell and they get stuck in the brain capillaries. So with it, your clinical signs from that, if they're below 9 months, they really don't get sick with it yet. They'll have a high fever, inflamed mucous membranes, anorexia, tachycardia, weight loss, and even possible abortion. When you look at it at necropsy, you will see petechial hemorrhage because of the intravascular hemolysis, emaciated, icteric, yellow-brown liver from all of the red blood cell damage, and then thin, watery blood. So again, diagnosis, you will find the tick and associate it with the symptoms, PCR and serology, but even before you go and diagnose it, they want you to call so that they can guide you how to do it. You can actually treat wildlife reservoirs. So your nilgai are, when I say resistant, they're resistant to, they won't eat the ivermectin corn. They're just a natural reservoir. You can feed ivermectin treated corn to white-tailed deer, but it has to be done during February to July so that there's an appropriate withdrawal time before hunting season. They have developed a border at the Rio Grande River of Texas, which is what I was talking about, the tick cowboys. And all cattle there have to be inspected and have to be sprayed to enter the country. They have developed a vaccine. It uses BM86 antigen. So what happens is when the tick bites and ingests blood, the antibodies that are in the cattle blood will damage the tick gut and kill them. The only downside is it only works against annulatus and not microplus. I remember it because A is the first letter in the alphabet, so annulatus would be the first one to be affected. So that's babesiosis. So then thyroleria, we have 3 different species of thyroleria. Thyroleriosis parva is East Coast fever. And when I say intralymphocytic, that means that it's found in white blood cells. Thyleria annulata is tropical thyleriosis, and it is found in both white blood cells and red blood cells. And then Thyleria orientalis is only found in red blood cells. It is endemic to the U.S. because this is the one that is vectored by the Asian longhorn tick, that Ikeda strain that I was talking about earlier. And I have it right there, the Asian longhorn tick. General life cycle is the tick will bite, release the sporozoites. It'll enter either your lymphocytes or your red blood cells, even parva that enters the white blood cells. Eventually, it'll enter red blood cells to repropagate, or it can enter white blood cells again and just continue. For parva and annulata, their host is Rhizocephalus appendiculatus, the brown ear tick, and then orientalis is the Asian longhorn tick. It infects your ruminants. Signs: swelling lymph nodes near the bite site, petechiae in the mouth and conjunctiva, death, jaundice, pyrexia. Like I said, yeah, Asian longhorn ticks are good vectors in general because they have a very wide host tick range. They spend most of their time in the environment and not on the animal, so it's hard to kill them, and they're parthenogenic. Diagnosis: clinical signs, blood smears, PCR, and you can ID the tick as either that Asian longhorn tick or as the brown ear tick. Next one is equine pyroplasmosis. There are 2 species that I've already talked about. There's Babesia cabali and Thyleria equi. Babesia cabali is Dermacentor nitens, which is the tropical horse tick, and then Thyleria equi is the Amblyomma Cajunense, which is the cayenne tick. Right now, equine pyroplasmosis is found in Southern Europe, Asia, Africa, Mexico, Southern and Central America, and Australia, basically everywhere but here. If cases have happened in the U.S., it's often because of illegal things that have happened with horses, like blood transfusions, blood doping, reusing needles, dirty dental equipment. Same life cycle as general thylaria. So B. cabali is your red blood cells. I like to think of it because it has all three letters. Well, sorry, it does not. It has the B and the C in red blood cells. I know white blood cells do too, but for some reason it works in my brain. T. equi does not, so it goes with white blood cells without the letters. So WBC. Okay, whatever. Clinical signs, icterus, hemoglobinuria or hemoglobinemia, petechiae, hepatosplenomegaly, pulmonary edema. So a common theme that you see with these foreign animal diseases is if you see petechiae, especially in that mouth, it should go ahead and clue you in to foreign animal diseases. Diagnosis, it is reportable, so you have to report it to the National Vet Services laboratories. Clinical signs, look at the history, competitive ELISA, complement fixation test, and PCR. All horses that enter the U.S. have to have a complement fixation test and test negative for this. So that's going to be so much fun with our upcoming Olympics for the vets to have to test all of those horses that come in. Treatment is imidacarb dipropionate, but because there are very serious side effects that can happen with it, we won't do it unless you are have become regulatory personnel. So it's only treated through the USDA treatment program, or they're euthanized. In that treatment program, by the time it ends, they have to have a serial negative PCR, and they cannot transfer it to native horses if there is a blood transfusion. And this process can take up to 2 years. The next one is trypanosomes. So trypanosomes, your reservoir hosts are your cattle. Right now it's really found in Africa, but it has made it to South America. And in Africa, they've actually started breeding more Ndama cows because those are resistant to trypanosomes. So if it's in Africa, it's vectored by the tsetse fly. If it's in South America, it is transferred by the biting fly. How it goes, the fly injects the trypanomastogote, it will circulate in the blood and then cross into cerebrospinal fluid. Clinical signs, sometimes it can be asymptomatic, local swelling, intermittent fever, anemia, lymphoadenopathy, weight loss, decreased milk. Control, you can apply repellents, you can quarantine, you can also use the sterile insect, which I don't know if she really I know she talked about it a lot, but basically what they do is they'll make male flies and heavily produce them and then release them out into the wild. And those male flies have been genetically modified where when they breed with the female, it makes the female sterile so that this female can no longer lay more eggs so it can reduce the population. They've done that with a lot of mosquitoes and everything here in the U.S. as well. And that's how they originally eradicated screwworm here in the U.S. as well. So you can also limit activity during peak. Oh, sorry, I'm not even showing it. Limit activity during peak fly time. There's other species as well. There is T. evansi, which causes surra. Surra is seen more in like your horses. It is vectored by the deer, horse, or the horsefly, which is called tabanids. Clinical signs, parasitemia, which we haven't talked about because we don't, animals don't have malaria, but basically, like with malaria and so with surra, when those like merozoites rupture from the red blood cells, they actually send signals to each other where they rupture all at the exact same time. So the fevers that come with these happen in a pattern. So like people with malaria, you can diagnose it pretty easily if it's a off fever and then in 4 days they have another fever, but then it goes away because of the timing of those red blood cells being ruptured. Then there's Trypanosoma equipertum, which is dorine. Donkeys are asymptomatic carriers, and it is venereally transmitted, so no bug Symptoms: genital edema, mucopurulent discharge, silver dollar plaques, which is like the key thing with this one, progressive neurosigns and emaciation. Diagnosis: clinical signs, complement fixation test, and PCR. So that's our last 4 in animal disease, and now we'll do flies. And there are so many flies, for some reason. We already know this, but the parasitic stage with myiasis is the larva. The big one is Cochleomya hominovorax. I got this wrong on the quiz. The primary screwworm and the New World screwworm have the exact same name. They are both Cochleomya hominovorax. It took me forever to get that question right on the quiz. All of my drawings are terrible, but it's fine. Big giant orange eyes. They're very like blue-green, and then they'll have these characteristic black stripes. Life cycle: they are obligate parasites, so they have to have a host to live. The females only mate once, so that's why it was such a good target for those sterile insect techniques. Because if the male mates with them that once, that sterile male, it'll make the female sterile, and then they can never lay an egg. Eggs eat live flesh. It is zoonotic, which is scary. Clinical signs: you will see the larva by the time 3rd day of an infestation has happened. The animal will be depressed and stop eating because it is such a painful bite, and it's very susceptible to secondary infections. Diagnosis: you collect the maggots, you report it to the state. Treatment: you need permission basically from the state vet to treat. Doramectin is injectable. Fluralaner is the topical for cattle. In dogs and cats, you can use lotilaner, and then only in dogs you can use afoxolaner. Again, was eradicated in the U.S. by that sterile insect heat that I talked about, and they still produce the sterile males and release them into the border to prevent this New World screwworm from crossing into the U.S. So then cutaneous myiasis, there are 2 general causes: is your caliphorids, which are your blowflies, and your sarcophorids is flesh flies. We learned in microanatomy that sarco, that was one of our prefix words for the bonuses, means flesh, so that's why it's the flesh fly. They lay eggs in moist areas, so that's why they like to lay eggs in already formed wounds, and they'll feed on the dead tissue. They can form ulcerative lesions that can lead to systemic toxicosis. Treatment: you clip the area, you clean it with betadine, you treat the secondary infections and treat stress, and then you can apply repellent to prevent further infection or further myiasis. Different bot flies: Cutebra is with our cat and dog because cats and dogs are just so cute. Cattle bot fly is Hypoderma. Sheep bot fly is Oestrus ovis, which is zoonotic. Horse bot fly is Gastrophilus. So the cattle bot fly, which is our Hypoderma. They lay the eggs on the legs, the larvae will penetrate into the skin, and then they migrate to their resting spot. Based off of the season is where they go. If they're in the fall, they like to go to the spinal cord and the esophagus. If they are in the winter, for some reason they like to go to the back. I don't know. Then they will form a warble, which is basically, they make themselves a port that they can breathe out of. They will molt, and then they will fall out of said warble. They will pupate and mature in the environment, and this whole process takes a year. Signs: low mortality, decreased weight, decreased milk, skin damage, and gadding behavior. Honestly, all of the signs are almost the exact same for all of these flies. My pen started to die, so it's really hard to see this. A big thing is you cannot treat any of these dairy cows if they have the bot fly. You also don't want to treat them if the larvae are migrating, because there's the potential of it going to the spinal cord. If they die once they're in the spinal cord, it can cause paralysis. So then our sheep nasal bot fly, again, this is the zoonotic one. The female genuinely shoots the larva up into the nostrils, which is whack. They develop and they molt twice up there, and then they fall out of the nose and pupate and mature. Signs: your nasal signs, your mucoid discharge in the nose and sinusitis, sneezing, secondary infections. You can treat with ivermectin or your macrocyclic lactones. Horse spot fly. Life cycle: eggs deposit on the mouth or in the legs. They hatch, and then they go through their first and second stage, and then they genuinely can crawl into the mouth, or they can just crawl through the skin if they're on the legs. Sorry. They will develop in the non-glandular stomach. We saw some of these in anatomy. They grow there for 8 months, and then they poop out in the feces. Signs, usually none, unless it's a very heavy infection. You might see lesions in the mouth or salivating, erosions and ulcers in the GI. Rarely it'll cause gastric perforation and esophageal impaction. Treatment, you can treat them with macrocyclic lactones, but it's recommended to wait till after the season, because if you treat it and then another botfly comes along, they'll just get reinfected. So, okay, it bled through. So there were 2 different kinds of flies. I don't know why we talked about it here instead of before, but Nematocera are your long antenna flies, so like your mosquitoes and everything, and then Brachycera are your short antenna flies. So your mosquitoes, there are 3 species that are important in vetmen: your Culex, your Aedes, and your Anopheles. Honestly, that's also important in humans. They vector for horses West Nile virus and multiple encephalitis viruses, and they can, cause general damage that they cause to us. Culicoides is your biting midges. They look like very tiny mosquitoes, and they also only have females that suck blood. Complete life cycle, they love rotting vegetation, so like your hay that is going bad in the barn. Direct damage is just a very painful and annoying bite. They are active at twilight, they can fly long distances, and they vector multiple diseases. They can cause sweet itch on our horses, which is also seasonal equine pruritic dermatitis. Basically, the horses have a giant reaction, an allergic reaction to culicoides. Prevention, repellent, mask, remove the bad vegetation, and you can also do smoke. Simulium is the black fly. It has a complete life cycle. It loves running water. It's very vicious. They are sunset biters. They will not bite at night. They can kill, and they can also cause an allergic response. They vector onchocerca, which is a human disease, and leukocytozoan, which is what I will talk about with the birds. Sandflies. It vectors leishmania, which we've already talked about before, which it's also zoonotic. Lutzomia is the new world. Phlebotomus is the old world, and they are nocturnal. The way I tell them apart is they look really bland. They are the color of sand. That's all that you need to know. Okay, Tabanus, which is our horsefly. Thankfully, I have never been bit by one. I am so sorry if you have. This is my terrible horsefly. Big eyes, they're brown, dark wings. Only the females eat blood. They lay eggs in the vegetation, so again, your hay. Then the larvae will overwinter, pupate, and the adults come out in the spring and summer. Daytime biters, they like to chase the host. They are less active in windy and cold temperatures, which is why they love the south. Hard to kill. You can stable your horses during the day, and you can set traps. They can vector just multiple bacteria and viruses, and very rarely they can vector trypanosomes. Hematobia irritans is the horn fly. Sorry, I'm out of breath. Both sexes will eat blood because they are obligate parasites, so they require the host to live. The pictures have them as like yellow and black striped, so they kind of look like a bee. They lay eggs in manure, then they'll pupate and overwinter and emerge in the spring. But they really like fresh manure. It needs to be like just came out of the animal. A very painful bite, so your animals will show signs of pain. Because of the overuse of ear tags with horn flies, they have developed resistance. So the recommendation to slow that resistance is use the tags only during the main season, and then rotate the tags, which is actually different than the recommendations for other resistant parasites. Your Stomoxys calcitrans is the stable fly. The males and females also eat blood, but they only are on the host when feeding, so they can be hard to diagnose. They are spotted. Eggs, they like to lay eggs in moist things, so again, poop, painful bite, same symptoms. Mucosa domestica is our housefly. They do not bite, they have lapping mouth parts, but they can be mechanical vectors for a lot of like your bacteria, those kind of things. And then they can also lay their eggs in wounds and cause secondary myiasis. Musca autumnalis is the face fly. It looks like a housefly, but they're just a little bigger. They feed on nectar or cattle secretions, which is why they can be mechanical vectors for pink eye, which is Moraxella bovis. Yeah. And then the last one is Melophagus ovinus. It is the sheephead. It looks like a tick, but it has 6 legs. Ticks have 8 legs. Females and males suck blood. The entire life cycle happens on the host, so you can find them on the sheep. Interesting though, females keep the larvae inside of them, and so once they lay the larvae immediately pupates them. Transmits by direct contact. Your signs: anemia, emaciation, irritation, self-trauma, and reduced fleece quality. Treatment: you do sprays and dips, but it's recommended to wait till after shearing because that's when their skin is most exposed to the sheephead. So then our birds. I called it poultry. I meant birds. Histomonas miliagridis is blackhead disease. The main host is turkeys, but chickens are reservoir hosts, so chickens are asymptomatic. It likes to go to the cecum in the liver. Interestingly, it likes to rest in heterachus eggs, which we've already talked about last semester. They have a direct life cycle. Signs: they like to destroy that cecum. They form something called cecopores, which are cheesy and hard plugs. My trophozoite looks like a sperm, but you know it's a trophozoite. Causes necrosis of the liver, and that necrosis looks like a bullseye. Has sulfur yellow droppings, cyanosis of the combs and the wattles, apathy, weakness, and the baby turkeys, which are called poults, are very susceptible. Diagnosis: usually they die, so you do necropsy. Sometimes if you catch it, you can do presumptive, and you can do PCR from the liver and the cecum. There is no treatment. If someone tells you they have bought the treatment, they are either liars or they are doing something illegal, because arsenic treatment is now illegal in the U.S. Prevention: biosecurity. Do not mix the chickens and turkeys, and you can use fenbendazole to kill those heterachus eggs that this histomonas likes to hide in. So then we have Trichomonas gallinae, which is avian trichomoniasis. It's mainly in pigeons, and in pigeons it's called kinkers. In raptors and chickens, it is called frounce. Raptors only get it by eating the pigeons. But your pigeons get it by crop milk, so passing down to baby, courtship, or contaminated water, such as bird baths. So the bird baths need to be cleaned. It stays in the upper GI, so in like the esophagus, in the mouth, and the crop. Signs: you will have plaques of yellow-white exudate in the mouth and the crop, anorexia, dyspnea. They can develop partial immunity if they recover and become carriers. It's usually also not deadly. Treatment: if they're a food animal, you can't treat them. If they're a non-food animal, you can use metronidazole. They do that out at the Raptor Center. Diagnosis: crop swab, PCR, and you can do a fecal. Control, sanitation, and prevent pigeon contact. So then we have our Eimeria species. So there are a ton of species, but we only needed to know the ones that can actually hurt them. So for chickens, the Eimeria species are Brunetti, Necatrix, and Tenella. Brunetti is in the rectum, Necatrix is in the small intestine, and Tenella is in the cecum. For turkeys, it is Eimeria adenoides. Adenoides is only in the cecum and the rectum. Clinical signs: intestinal inflammation, diarrhea. Treatment: you use coccidiostats. Vaccine too, which is super cool. And the vaccine works because it can target multiple species. So one vaccine will target, I think it's up to 8 different species of Eimeria. So Hemosporidian, so those are parasites that like to live in blood. We have 3 of them. Plasmodium, it is not malaria. We will not get malaria from birds. Plasmodium is vectored by mosquitoes. It is found in wild birds. They will have fever, anemia, weakness, hepatosplenomegaly, and you can see it in the red blood cells. Hematoproteus is more commonly seen. I've seen it here at the Raptor Center. They've never had Plasmodium here at the Raptor Center. It is vectored by Culicodes. It's not very pathogenic again, and it is found in the red blood cells. Leukocytozoan is vectored by that black fly, the Similium. It is not very pathogenic, and it's different because it can be found in the white blood cells. Okay, Chimex lictularis is the common bedbug, and they apparently love our birds. They can cause feather loss, skin lesions, anemia, decreased egg production, and weight loss. Control: when the birds are gone, So when the birds are dead, you can have a professional come and spray it and get rid of the bed bugs, and it is zoonotic. Poultry lice are very host specific, so they're not zoonotic. So there's three different kinds of mites. Dermanisis gallinae is the red mite of poultry. It is called a lair parasite because it likes to live off the host. They only come out at night to bite. So they're actually really hard to find on the bird. So you just have to look at signs: anemia, papules, and drop in egg production. To control, you can give them Floralaner oral and treat the premises. Ornithonisis silvarium looks the exact same as the red mite. It is our northern fowl mite. How can you tell the difference? This one has to live on the host. This one does not. So if you see it on a bird, it is the northern fowl mite. If they have signs of these, but there's no mite, it's the red mite. Heavy blood feeders, same kind of symptoms, and you control them the same way. Nemitocoptes is your scaly leg or face mite, or scaly leg / face mite. They are very circular, short, and stubby. They remain on the bird host, again, for their whole life. They like to burrow in shafts, so they cause severe itching. The bird will pull out their feathers, and the scales will loosen and come out. And if it's a pet bird, you can give it ivermectin. So are pigs. Pigs can have both Cystoisospora and Eimeria. Cystoisospora suis causes swine coccidia, but in our piglets, it causes neonatal porcine coccidiosis. Diagnosis. You can find the cyst in the feces. If it's fresh feces, it'll be unsporulated. If it's old, it'll be sporulated with 2 sporocysts with 4 sporozoites each. You can also do PCR, or if said sow has had litters in the past with neonatal porcine coccidiosis, it can clue you into this current litter. Your signs will be enteritis. The piglets are showing signs at less than 10 days old. They can have severe diarrhea with steatohorrhea, which is fat in the poop. Treatment: if it's the sow, it's Improlium. If it's the piglet, it is Toltrazuril. The way I remember it is Piglet and Tigger, and that just looks like something Tigger would say. It's a weird word. Eimeria is really only seen in your older pigs, and it's not really pathogenic. Balantidium coli / suis is in pigs. They have developed a new name for the one that can infect humans and primates is Neobalantidium coli. But Neobalantidium coli also comes from pigs as well. Their special features: they are ciliated. They transmit fecal-oral via the cyst, but the troph is what causes damage. You diagnose with a fecal or a Behrman. It is an opportunistic pathogen in our pigs. And so, like, if a pig already has swine dysentery, they take advantage of the weak immune system. Causes mucosal damage. If there's minimal signs, you don't have to treat it. But in us and in our primates, it'll cause ulcerative colitis. They can have sarcoptes, scabiei, but it's the same as dogs. You diagnose with a skin scraping and treat with microcyclic lactones. They have 2 lice. They have Hemidopinus suis, which is the blood-sucking louse of the pig, and then Ornithodorus, which is the soft tick. So then we have one of them for fish, Ichthyopterius multifilus, which is ick, or white spotted disease. It is terrible. Basically, if you have this on your fish is dead. Yes, there's treatments, but they don't work. So the trophs are on the skin and the gills, and when they leave, they form a cyst. The cyst develops what are called tomites inside of them, and the tomites need a host in 48 hours. But what she didn't talk about is, the cyst likes to go to the bottom of the tank, and they just form a huge multitude of cysts, a big pile of cysts at the bottom, and then they all hatch at once. So it just floods the entire environment with tomites. So if this happens in a lake, all of your fish are gone. They're all dead. So I've had many a betta fish, sadly. They come from PetSmart already having this, and then it develops a few months later, and you're like, well, crap. Anywho, so your signs: you'll have necrosis of the skin and gills. Death is very common. Like I said, your diagnosis: you can do a skin scrape and a gill clip. Those of us that went to the Gulf area, we actually learned how to do this. It was pretty cool. Again, super hard to treat. There are technically copper-based solutions. They don't work. You can heat kill them. If you do try to treat it. You have to do it in multiple doses because the cysts are resistant to the treatment. The only one that we need to know for reptiles is Entamoeba invadens, which is reptile amoebiasis. Turtles are asymptomatic. My brother's turtle actually has this, but again, it's a turtle, so it doesn't hurt him. The infective stage is a cyst. The signs, so like in your bearded dragons and everything that's not a turtle, anorexia, bloody mucousy poop, increased water intake, apathy, and spastic movements. You can diagnose with a float and then treat it with metronidazole. So that is all for parasitology, and good luck!